Yeah, good day once again. This is me, um, Nurse Idara Ruth Ninga. Okay, today we'll be talking about prioritization in the NCLEX exam, right? So when you are prioritizing in the NCLEX exam, there are certain principles you should follow. Okay, one of the principles is that you don't you should be able to prioritize unstable patients over stable patients. Now, who are the unstable patients? Unstable patients are patients that are acute, who are having acute symptoms. Take for instance, you have new onset symptoms, okay? A patient that just arrived, like a new admission, should be prioritized over somebody that has been on bed. Okay, a patient with a post-op patient, let's say a post-op patient who is still within 12 hours should be prioritized. Okay, so we are talking about post-op patients within 12 hours of from the theater should be prioritized. Those kind of patients are unstable. A patient that is newly admitted should be prioritized over a patient that has been on bed. Okay, then you now talk about a patient who just came back from a procedure. A patient that just came back from a procedure should be prioritized over, because there might be new symptoms that may be occurring. Okay, so you prioritize such a patient, you assess such patient. Okay, a patient who is having unexpected symptoms, patient with unexpected symptoms should be prioritized over one who is having expected symptoms of a disease. Take for instance, someone that had um take for instance someone that had x-ray is not expected to develop chest pain from an x-ray, but when he returns and is beginning to have chest pain, or is beginning to have abdominal pain, is an unexpected symptom, so you must assess such a patient. But someone with expected symptoms, like somebody with gallbladder stone or uretolithiasis, renal stone, having pain, such pain is expected in such disease condition. Okay, so you don't prioritize such patients. Okay, so those are the things we are talking about. Then vital signs, you know hyperthermia, temperature of 38, 39. Okay, those are symptoms that are reflecting new onset infection, so you can assess or prioritize such a patient. Okay, then but remember that in your prioritization of symptoms, it should be unexpected symptoms. Okay, then there are symptoms that are showing signs of worsening states of that particular disease. Symptoms like, take for instance, you are having an asthmatic patient who is now presenting with wheezing, or maybe sudden cessation of wheezing. Okay, such a situation, it's possible that that patient is having complete respiratory blockage, that is complete airway blockage, or you are having something like um difficulty in breathing. Okay, so you must prioritize such a patient. All right, then the other ones that you should prioritize are assessment. You prioritize assessment over implementation. So when a situation occurs, you are supposed to first assess the patient, first assess the situation. Okay, rather than just going to implement. When you see a symptom in a patient, you don't just go and administer medication. You don't just go and carry out you know any action. You must first assess. Now, if the question now tells you that they've assessed and maybe they saw hyperthermia, or they assessed and maybe they observed dyspnea, or oxygen saturation of 88 and all of that, then the next line of action will be to implement. So you follow the nursing process when you are doing prioritization. Okay, then another principle of prioritization are lab values. You prioritize abnormal lab values that can kill, that can cause problems. For example, hyperkalemia that can cause cardiac distreatment. Prioritize them. Okay, a patient presenting with potassium levels of 6.5, 6, 7, that's terrible. It can cause cardiac arrest, so you prioritize those kind of lab values. Excuse me. Hyponatremia, hyperkalemia, hypermagnesemia, okay, because that can cause toxic depontis. So any of these lab values that are quite abnormal, EUCR, when you see EUCR in a patient who came with diarrhea, for instance, and decided to do an EUCR, and the EUCR is showing elevated creatinine levels, you must prioritize. Or a patient who is going for a radiological exam that requires dye, and then they did EUCR, and the EUCR is showing signs of elevated creatinine levels of maybe 1.3, 1.4, above the normal range of 0.6 to 1.2. You must prioritize such a patient. Okay, so please, I'll be stopping here for now. I'd like you to share I'll be stopping here for now. I'd like you to share this content and like this video so that more persons can see and then follow and watch what you are watching. Thank you very much.